Good evening, everyone. I am Dr. Om Patel. I am an eye surgeon and I am specialized in pediatric ophthalmology and squint. So, today I will guide you through the basics of what is squint, why it is important. So, the first thing is what is squint or cross eyes. As we all know, in squint, what happens is one eye looks straight and one eye either goes outside or it goes inwards or it goes upwards or it goes downwards. So basically it is a misalignment of both the eyes. One eye looks straight and other eye is deviated. Now why it is important? Is it just a cosmetic issue? It is not just a cosmetic problem, because what happens is that when we look straight with both the eyes, we see one object with both the eyes, while a patient having squint, one eye looks at one object, deviated eye looks at another object, so the brain will receive two different images. As a result, there will be confusion in the brain and brain will try to switch off one eye or suppress one eye. So essentially the patient of squint only uses one eye and one eye is permanently blocked. So it is as good as one eyed vision or it is as good as one eye blindness. Now coming on to the age group of squint. Squint can present at any age. It is common in children, it is even common in adults, and both kind of squints have different etiology or different reasons for the squinting, and the management is also slightly different. First I will highlight about pediatric squint or squint or cross eyes in children. So why is it important that to diagnose the squint and how does it affect the child? So the child, while the age of development, if looks with only one eye and one eye is deviated, then the brain is not adapted to use both the eyes at the same time. So what happens is that the child will lose the vision in the deviated eye. The eye which is squinting will not participate in the vision, and if it will not participate, it will gradually lose the vision. So there will be decreased vision, which we know as amblyopia, and there will be also decreased 3D vision on depth perception. I will guide you through some brief point what is depth perception and what is 3D vision. So what normally happens is that when we look with both the eyes, our brain receive slightly dissimilar images from both the eyes, and from that our brain reconstructs a three-dimension vision. Now in the child or in an adult with squint, what happens is that they use only one eye, other eye does not participate in vision. As a result, one eye is suppressed and the child does not develop three-dimension vision. So as for that sake, squint in a child can be considered sort of emergency, because if we neglect the squint, the child loses the ability to see perfectly and the child will also lose its three-dimension vision. So now comes the point, at what age shall we correct the squint, or is the squint can be corrected? The answer is definitely yes, and we can start the treatment as early as 3 to 6 months of age. And it is not necessary that surgery is not the only treatment of squint. Some squints, depending on the type of squint, some squints can be corrected with glasses, some can be corrected with exercises, and if it does not get corrected, then squint surgery is the last option. So what do we do in squint surgery? The movements of the eye is done by extraocular muscles which are attached on the white part of the eye. So what happens is that there are muscles which take the eye in all the different directions. In squint surgery, we try to loosen up the muscle which is acting more than needed, and we try to tighten up the muscle which is acting less than needed. So what we do is that we adjust the extraocular muscle, and as a result we get the good alignment of both the eyes in all the directions. The other frequently asked question is whether it is safe to do a squint surgery in children. The answer is definitely yes. The surgery hardly takes half an hour to 1 hour, and there are no major complications as far as surgery is concerned. and anesthesia is also very well developed these days. So a child usually has a very hassle free and smooth experience out of the anesthesia. We have dedicated pediatric anesthetists who give anesthesia in pediatric patients or children, and they are quite well equipped with newer drugs and newer delivery systems. We can give a quite predictable results with pediatric anesthesia. We can operate as early as the age of 6 months, and it gives wonderful results. The more early we intervene, the more good are the outcomes. So now coming on to the second part of the discussion, that what can squints occur in older individuals? Is there a chance that a person will have a squint overnight? There are many patients who come to us that he suddenly got up and he is having a squint. Or so the squint in adults is a bit different from the squint in children. Squint in adults often raise an alarm to the systemic illness. Patients having diabetes, patients having hypertension, patients having any intracranial tumors, the first sign of presentation is usually squint, and it is due to the paralysis of one of the nerves that supply the extraocular muscle. Nerve arising from the brain gets compressed, or there is a compromise in the vascular supply to the nerve, which leads to paralysis of the muscle, and that leads to squint. So in simple terms, we can say it is called as eye stroke. Another reason for squint in adult is any kind of trauma. While in road traffic accident or in any other injury, there could be injury to the muscle, there could be injury to the nerves, and it can also lead to the squint. So again, what are the symptoms of the patient? If an adult patient develops a squint which is very sudden, he often complains of double vision or diplopia, because his brain is used to see with both the eyes, and now what happens is suddenly one eye looks straight, one eye goes inside or outside, and there are two different images in the brain, and the person will get confused. So this is the most common symptom of diplopia. Another is obviously cosmetic issue for young adults who are planning their marriages or who are college going. They have a cosmetic problem. And coming on to, is it treatable? So most of the squint these days responds quite well to the therapy. Now it depends on what is the cause of the squint. The treatment will depend, how to approach the squint patient will depend on what is the cause of the squint. So if it is due to diabetes, if there is some small eye stroke, we usually wait for 3 to 6 months of age, as this condition improves gradually on its own. But if there is some residual squint, even after 6 months of waiting period, then we can definitely go in for the surgery and can correct that squint. Another thing is as cosmetic squint correction can also be done in the patients, and they usually give very good results. It even improves the confidence of the patient, and it gives them a whole new life. Are there any major complications in squint surgery? So as there are no major complications in adult squint surgery, we usually do not require general anesthesia. We can give a local block, like we can give a small injection near your eye, and we can anesthetize your eye, and then we can safely do the squint surgery on your eye, which usually lasts from about 30 minutes to 1 hour. Another question is, what is the latest age of squint surgery as in adults? So I would like to say there is no specific age limit on what is the latest time when we can operate. We have operated patients till the age of 80 years or more, and they are doing wonderfully good. These patients are usually they come to us for any other problem, maybe a cataract in the eye, and we can offer them that we can also correct your squint as well as your cataract, and we can get a very good results out of that. I would like to thank you for patiently hearing me during this time. I hope it gives you some basic idea about what is cross eyes and what is squint, how we can correct it. and you can definitely reach me at my email address or my phone number for further assistance, and we can definitely guide you through the process. We can even give you some of the testimonials of our happy patients who are ready to share their experience, who have experienced the change in the life after their squint correction. And I would definitely like to have your questions on this. Any questions regarding squint, its correction, is it safe or not, at what age we can do, how do we do surgeries, what is the bed rest do you require, any kind of questions are welcome. I would again like to thank you for watching this video. Thanks again. This is Dr. Om Patel, your squint specialist and pediatric ophthalmologist, Aksha Eye Hospital, Rajkot. Thank you.